Welcome back to my channel. Today's video is going to be focused on how to survive year 3 of medical school. Just a little disclaimer, this video is going to be focused on my experience as a year 3 medical student following the course curriculum that my university provides. Every uni will have a different curriculum, so please take what you will from this video and apply it directly to your own curriculum. Just some basics for year 3. It is a step up because you're transitioning from preclinical to clinical, meaning that now you're going to be in hospitals or going for outpatient visits, so learning content on top of this. So prioritizing your work-life balance here is really important, and I will touch on a few things in this video. Monday to Friday was my structure for year 3. Monday was basically a full day of lectures starting at 9 o'clock, and we could finish anywhere between 4 to 5 p.m. in the afternoon. Tuesday to Friday is placement, so you can be doing surgery, elderly medicine, psychiatry, or just medicine itself. Within all of those, you have multiple different rotations. They can last anywhere between 1 week to 2 weeks. Personally, I found that surgery was the most structured out of all of them, then medicine, then elderly, and then finally psychiatry. Psychiatry was kind of a free-for-all. We were sent to many different rogue locations. One of the questions I got asked was how to deal with mean surgical consultants. I hate to break it to you, you will meet a lot of mean people in the workplace, people who particularly don't like students. That could be anyone from a consultant to any other member in the team. It has happened to me and it's happened to some of my friends. Sometimes we just don't take it personally because people are having really difficult days. But if it is prolonged and it is repetitive and you feel singled out, that is something that you need to discuss with somebody. So people to talk to would include teaching fellows, or any doctor that is assigned to you and that you feel comfortable talking to them, someone from university, so maybe student advice or your module leads. The earlier that you talk to somebody about it, whether you think it's a big deal or not, more comfortable you're going to feel going back to that, for example, particular ward or hospital or working with a particular team. I had this experience. It was so distressing. I had to go and talk to 2 of my supervisors about it. But in the end, there was some resolution and I reflected upon the experience and I felt comfortable going back to the ward. For surgical placement, if you're looking to assist in surgeries, I would highly recommend you go in early, introducing yourself to the surgical team. If the surgeon is there, also introduce yourselves to them. Meet the patient and introduce yourselves to them too. Make it known quite early on that you would like to scrub in. Sometimes the opportunity is not there, so you would just be asked to stand and observe the surgery. If you are wanting to become a surgeon, I would highly recommend finding a surgical society and asking them about a surgical portfolio, especially if you're assisting with any surgeries from year 3 onwards. I particularly liked elderly medicine because this is where I learned to write patient notes. So if you ever see people walking around with a book open and they're scribbling things down, that's because they're doing the notes for the patients. A lot of the resident doctors will prepare these notes early on in the morning, and then they'll see the patients and continue the sheets and talk to the consultant about them. So there is an opportunity for you to do this. You just have to be interested in doing it, and if you don't know how to do them, you can ask somebody to show you. Psychiatry was a 5-week block for me and it was a little bit all over the place. I was partnerless. I made my life a little bit difficult when going to the wards because I wasn't allowed to go out by myself. Medicine was my final block and it was the busiest of all of them. And in my final term, I also had to start preparing for my end of year exams and my OSCE, so it was a lot to balance towards the end. I'd say it's normal to be nervous, especially in the first few weeks of starting hospital placement because it's a really new environment. Being organised is key to placement. Find your handbooks, download them, read them, identify the key components including sign-offs. I then make a checklist in my notes app on my phone. You can get multiple sign-offs in one day if you go into placement with a plan. You could go in for a ward round in the morning, in the afternoon come back for a history and examination and then present these to, for us it had to be an F2 and above, and get feedback on them. If you're doing something like a mini kex, make sure you find somebody who is available to give you at least 30 minutes of their time, because with mini kexes you do both of them and you present them all in one go. You get asked questions, so very common things are like, what are your top differentials, what investigations would you do for this patient, and basic management. One of the best tips I can give you is to do some pre-reading before you go in for your rotations. For example, for vascular surgery, I knew this was a 2-week block for me and that there was going to be a lot of content, a lot of which I've never heard of or been taught before. What I did was I went to PassMed, I went to QuesMed, and I read the textbooks. I attempted all the questions that were hammer one or easy, and it just helped me basically build an understanding of what things I could be expected to see, signs to be able to pick up, and complications of certain surgeries. When I went into placement, I was able to then build on this by asking questions. I was able to see those signs in person, and this is how I built my knowledge for vascular surgery. I did this for every single rotation where possible. This meant by the end of the year, I was then moving on to second hammer or the harder questions, and I was able to then go back and redo any questions I got wrong from the first hammer, building up my score as I went along. One thing I would do differently if I was to go back in time is, whilst I was doing those questions on PassMed or QuesMed, I would also do histories and examinations using the AI-powered patients on Geeky Medics and PassMed much earlier on. I started doing this closer to my OSCEs. There was a lot to cover, so it would have given me a lot of time to build on this throughout the year. One thing I will say is when you do histories and examinations on patients in hospitals, more often than not you will have extra time compared to when you're in OSCE setting, which is a timed exam. In third year, I did 4 case-based discussions. For surgery, I chose a vascular case because that was the placement I enjoyed the most. For elderly, I did a falls case, and for psychiatry, I did a first episode of psychosis. In medicine, I chose to do a respiratory case. Case-based discussions are where you find a patient of interest in the module. You take a history from the patient and you perform an examination. Think of appropriate investigations according to NICE guidelines. Perform basic management of the patient. One thing that was really important for me was to follow up my patients. I remember one of my patients got moved from the main hospital to a rehabilitation centre, and I literally went and followed them so that I could see how they were doing. I did very well in my case-based discussions in year 3 because I followed up my patient, and that is the one thing I would recommend you do too. Another question I got was about attendance. So for us, 80% was mandatory. However, all sign-offs needed to be done by the end of the module. Our terms were 11 weeks. Final week was for the case-based examination and to make up any final sign-offs. You needed to make those sign-offs up by the end of that 11th week to not fail the module altogether. I'd finished all my sign-offs before my 10th week, which meant that I could prepare for my case-based discussion and then have a little bit of free time in my 11th week. Life will continue outside of medicine forever. That is just simple and plain, and it's never going to change. If you are struggling or something has happened in your own personal life, the best thing that I can recommend you do is to go and speak to student advice or somebody that is in charge of your module. Tell them that you are struggling or tell them that you need some time off, whatever it is, and then they will be able to help you retrieve your sign-off so that you don't fail the module and don't end up failing the entire year. When you dress the part, you actually feel like you're part of the team. I wore my NIM scrubs for all of my hospital placements in year 3, and for outpatients I wore my own clothes. These navy blue NIM scrubs were my first love, and now I have a new love, which are my seal blue scrubs. These are the seal blue scrubs from NIMS. I absolutely love the colorway. They're super comfortable, and my favorite thing about them is the number of pockets they have. One of the best things I did this year was investing in a pair of high quality scrubs that I could wear time and time again, not worry about the quality deteriorating after washing the scrubs. And they're super affordable for students because they do bundle discounts, or you can use my discount code medwithmaz for 20% off. You do get free hospital scrubs, and you should get some scrubs from your uni placement. You will spend a lot of time on your feet, whether that be in theatres or following the ward rounds. I would recommend investing in a pair of compression socks. You can find them on Amazon, and have a pair of comfortable shoes. For hospital placement, I wore my Echo Storms, they're Crocs. I wore my Nike trainers, I wore my Skechers. I just alternated depending on how long I was going to spend in the hospital. Work-life balance, they're words that you're going to hear for the rest of your career. This is the first year where I felt like I've done so much outside of medicine. If you have one thing that you're really looking forward to in your week, it really helps get through the week. It's not compromised on my ability to successfully complete year 3. I lived with my friends in my final term, so that was my medicine block, and we made an effort of having movie nights. We would go out for walks on the beach, we'd go out for meals, simple things, spending time, enjoying your company with, whether that be yourself or your friends and family, is really important for you to be able to focus on long days at placement, and you'll hear this time and time again from every single person that talks about work-life balance, is to take breaks. There is no point of doing a 9 to 5 on placement and then coming home and immediately sitting down to revise. You need to take some time to unwind. How you do that is up to you. For me, it would simply be to take a nice hot shower, to get into some pajamas, cook some dinner and watch an episode of something, and then maybe do some light revision in the evening. Where I had days that were half days, utilize that time by going to the library, in the hospital, and finishing off some work or some revision or working on my cases, and then I would go home and unwind. You just have to be smart about your time. You don't need to spend the entire day studying, and remember to do something every single day. On top of placement, we had a lot of lecture content to get through. For this, in the summer holidays, I asked a then third year if I could have their Anki deck, and they shared it with no problem. Throughout the year, I would then build on these Anki decks. Reviewing your Ankis regularly will help you in the long run, but there is no point of sitting there and making Ankis if you're never going to look at them. Besides Anki, I would do as many questions as I could find on the particular topic for my lecture contents, and I would use the basic methods of blurting, using the whiteboard method, and teaching my friends. For exam season, my friends and I decided that we would tackle a few topics together. So psychiatry, we booked out some study rooms, and for the entire day we ran through our entire psychiatry module. It was very helpful because psychiatry was heavily represented in our end of year exam. Finally, I'm going to talk about OSCEs. They're a really big thing in third year because now you're doing OSCEs that require a lot of clinical knowledge. Start early. I'm learning from my own mistakes. Start early. Geeky Medics is the #1 subscription I'd recommend. They have an incredible question bank for histories and examinations, but also another one for radiology. It's really important you know how to interpret x-rays, CT scans. Geeky Medics has an option where you can kind of go through the whole structure and also figure out spot diagnoses. Practice with your friends. It will not be like the real thing, but I promise you being able to talk out loud and counseling a patient, for example, is a really important skill, and the best way you can do that is to actually talk to another person. Obviously, the more you do during placement, the easier it will be for you to transfer these skills to then the end of year OSCE. OSCEs are timed examinations, so when you're practicing with friends, use timed conditions. It really reflects the real thing. Don't keep repeating topics that are easy for you. Do the topics that you really struggle with. I'd recommend doing any mock OSCEs that your uni offers or that societies offer. It really helps doing 9 stations in a row with a few rest stations here and there to mimic the real thing. Although, don't rely on those stations to come up in the actual OSCE because it will change year to year. One of the biggest differences for our OSCEs in year 3 were that at the end you get quite a lot of questions, whether that be explaining a condition or a procedure to a patient, answer questions from the examiner. So these could include things like, what are your next investigations? What is your initial management for this patient? The more you practice these questions with your friends or on Geeky Medics, the easier it becomes to recall this information. I promise you, you have seen this stuff on placement. You just need to be able to recall it within the space of about 20 seconds. This wraps up my video for third year of medical school. I really hope that there is something that you can take away from this video to help you. It is a step up, but you will absolutely thrive if you put a little bit of effort and time into placement. Do the normal things that you do for a revision. Look after yourself, and I mean your well-being and your mental health. Both of those are really important and sometimes more important than medical school. Talk to people, be interested and be curious, and you will go a very, very long way. I'm rooting for you. Good luck.